Good morning, everyone. In the interest of, we appreciate everybody joining us. We have so much good stuff to share that we want to get started right away. I'm Meg Distler. I'm with the St. Joe Community Health Foundation, and I am delighted to see many familiar faces, meeting some new faces here, and that you all could join us. The very first thing I want to do is to thank Parkview Health, who has very generously provided this delicious pizza, fresh from the oven, I think, pretty much. And I think the easiest way, Erin Norton back is on our steering committee at the Women's and Children's Outreach. And also we have a lot of other great supporters from Parkview. So I'm just going to, if you're with Parkview, can you just wave for a minute so we can say thank you to all of you guys? So thank you. Okay, we are, Sarah, if you could walk up this way. While she's coming up here, she's gonna share some requests, some information with you about a study that's going to be happening. But before she does that, well, actually, I'm gonna let her do that, and then I'm gonna give you an introductory assignment. So she has all your attention.
Hi, I'm Sarah LeBlanc, and I'm an assistant professor of communication at Purdue University, Fort Wayne. Me, along with two of my graduate students, are in the process of collecting data from new mothers who are either 6 weeks to 1 year postpartum. What we're hoping to do is we're investigating to see if there is a link between postpartum depression and the amount and the type of supportive communication they are receiving. So we have designed a survey, and my graduate student Rachel is passing out flyers in the hopes that you will help us recruit moms, especially here in Fort Wayne, to fill out the survey. And at the end of the survey, there is an option for them to participate in focus groups this summer. We're postponing the focus groups until this summer because we're hoping to get a couple of grants so that we can buy baby needs for these moms, seeing as I'm a fan of people need a reward for participating in a research study. So we're hoping to be able to buy those big boxes of diapers at Costco with some of the grant money that we receive to give to every mom who participates in our focus groups this summer. If you have any questions, I also have business cards that I'm willing to hand out, and I'll leave some on the table to grab on your way out. But this study is just starting, and we have 3 years of IRB approval to complete this study. Any questions?
Thanks. So please support that. We all need good research to make the best decisions. Now we're going to have kind of a speed dating thing in here. We're going to pass the mic, but we want everybody to introduce themselves, say your agency, and you get 10 words on what it is you guys are doing to help or serve pregnant women or infants or new families in the community. So we just have a very quick overview of the gifts, talents, resources in this room. So this is going to be, I'm going to start over here, but we literally need this to be very quick as we go through this. Can you start? Stand up, and if you turn around, that would be great. So we can see you.
I'm Kelly. I'm from Associated Churches, and I love our organization because of a baby's closet.
I'm Elaine Williamson, and my words are, we provide needed healthy items that help to have a healthy baby.
Vicki Stevenson, Associated Churches. Ditto.
JJ Foster, Fort Wayne Housing Authority. We open up our residents and properties to any organization that is expertise in this area.
I'm Kayla Grazzini, and I'm with Healthier Moms and Babies. And our job at Healthier Moms and Babies is to provide support, help, resources, and education to moms.
And I'm Madison Lyon. I'm also with Healthier Moms and Babies, so ditto.
I'm Carrie Eyrich. I'm with YWCA's Hope and Harriet program for women, and we help women take their lives back.
Marlene Krause, health coordinator with Early Head Start, and we provide home visits to prenatal women, and when their child is born, they enter our Early Head Start program.
Tammy Pfeiffer, Bright Point Early Head Start, along with Marlene. I like to say that we teach parents how to become their child's first teacher. So our school readiness program and our home-based kiddos are guaranteed a slot in Head Start when they turn 3.
Hi, I'm Carla Harrison with Health Visions, and we partner with the Indiana Minority Health Coalition to offer listening sessions on infant mortality.
I'm Terry Clark. I am with the Christ Child Society of Fort Wayne. We provide layettes, and we have some other committees that you'll hear about as well.
I'm Jean Wagner, and I'm with Christ Child Society Fort Wayne, and we stock the crib clubs in the women's care centers in Fort Wayne.
I'm Carrie Rice, and we provide coats to school children. I'm with the Christ Child Society.
Hi, I'm Julie Von Gutten with Young Lives in Fort Wayne, and we support and mentor teen moms right now at Northside High School and the Youth Life Skills.
Terry Swim, Purdue Fort Wayne, and I'm actually working with Laura on the GAP program for mentoring new mothers.
I'm Kristen Bunn with Covering Kids and Families of Bright Point, and we assist and apply for Medicaid for pregnant and non-pregnant families.
Connie Heplin with SuperShot, and we provide immunizations to the most vulnerable children in the community and keep the community healthy.
April Moord with SuperShot. We provide vaccines for infants in all ages and adults as well.
Phyllis Bragg, president of Chi Eta Phi Nursing Sorority. We provide safe sleep education as well as crib airs to those moms that need a safe place for their babies to sleep.
Sarah LeBlanc.
Rachel Mitchell.
Paige Wilkins with Healthier Moms and Babies. We give our community's most at-risk pregnant women the strength, encouragement, and hope that they can have a healthy pregnancy and be a good mom.
Liz Murray, Parkview Health, working with families with drug addiction.
Kai U, community health worker with Parkview Women's and Children's Outreach Safety Pin Program.
I'm Jocelyn Shi, Parkview community health worker. We meet mom where they are, and we refer them to the resources in our community.
Amber Ramsey, working at the same place, and then we are working with infant mortality, and we do the home visit and helping the community with the resources that they need with a pregnant mom and then a mom who has children under 1 year of age.
My name is Cindy Teese. I'm a individual here today. I'm a lifelong member of Bethlehem Lutheran Church, 46806. We're right in the midst of so much of the data that is circulating right now, and so I'm an interested congregant as well as individual. What can we do? We have a mighty fortress of a building, primarily unoccupied. What can we do?
Yvonne Neckham, and like Cynthia, I'm representing our church. We're just here to try to get information that we can take back to the women in our church, make them more aware, and find out ways we can help in the community.
I'm also with Yvonne from St. Joseph United Methodist Church, and we're trying to be part of the solution for children to have a healthier life here in our city.
John Wolf, I'm CEO for Community Harvest. We do food, and we serve 21,100 each week in our 9 counties. So,
I'm Joan Messman, and I work on a life team. Dawn, she's kind of our leader. But we do life, we center on life every stage, from life to death, before they're born to death. So, but we've been concentrating this year on babies, and we usually do a diaper drive every summer. We do baby bottles for the Hope Center. We do carnations for mothers, and the money that comes in for that, we do things for babies. Or, is that the Hope Center? No, Allen County Right to Life. And we do collections. Sometimes we just finished a baby shower to collect things for a mother's hope. And we made it fun and had prizes and gifts like normal baby shower would be. And we got all the collected items that they needed. So we keep busy, but life is what is the most important.
I'm Dawn Pashy, and I'll just say ditto.
Hi, everyone. I'm Cassius Stallings, Community Health Worker with Parkview Health. I love what we do and just meeting moms where they're at and then getting them connected to resources to be able so that they can take care of the babies.
Gwendolyn Carpenter, Program Manager, Parkview, Manager of the Innovative Program to help mothers in the community to reduce infant mortality.
I'm Gia Parker. I'm a community health worker with Parkview Hospital, and we connect mothers, families with resources in the community and offer an array of support.
Maria Diaz, Parkview, Women's and Children, community health worker, and the same.
Takia Arrington, Women's and Children's Outreach. We help mothers with their personal needs, family needs, and infant care needs.
Alice Kupfer, St. Joe Community Health Foundation. I'm a board member in the Grants Committee.
Joy Tiernan, A Mother's Hope. We work with pregnant homeless women in 3 areas of programming: shelter, education, education, employment, life skills, support, and spiritual aspects.
Kirsten Bailey, community health worker at Parkview, and I think my coworkers did a great job of explaining what we do.
Jania Freeman, Parkview community health worker, and the same thing.
I'm Sarah Giaquinta with Parkview Community Health, and I get to support a great group of nurses that does breastfeeding support, safe sleep classes, CPR training, and a lot of other things to support new moms in our community.
Jill McAllister, Parkview Community Health Improvement, and we focus on improving the health and well-being of the community, including young moms.
Good afternoon. I'm Deb Lelling, and I work in community nursing at Parkview Health, and I help facilitate safe sleep classes and breastfeeding support groups, and I work really closely with Gwen and all of the community health workers to assure families have the resources and are connected medically to assure that everything goes well for them.
And I'm last but not least. I'm Amanda Hakes. I'm a nurse with community nursing. I'm part of the homeless outreach team, so I guess I'm a frontline, all over the place person, trying to navigate and make sure they're hooked up to all the good resources.
Megan Teston with Healthy Families. We work with moms just to make sure that they learn how to be the best mom that they can be, providing child development information, support, books, and resources.
I'm Rebecca Holzklopp from a Hope Center, and here we do pre-pregnancy testing, limited STI testing, limited ultrasounds, and we provide incentives through a parenting education program.
I'm Sarah Gargak. I'm also with the Hope Center. We also provide support for our dads and a miscarriage and infant loss support group.
I'm Ashley Weiland, Mobile Operations Manager of a Hope Center, and we use our mobile to take our center out into the community.
My name is Salvador Espinoza, and I'm also from a Hope Center. I work in marketing, so.
Patty Leslie, Neighborhood Health Clinic, Prenatal Services and Peds.
Ty Akabal, Neighborhood Health Clinic, SWIC, and we provide nutrition education, nutritious supplemental foods, and lactation support.
Belinda Dean, the Neighborhood Health Clinic. We provide prenatal services as well as we do the safe sleep and donate the cribs out. We also have coupons for a baby's closet, and we also do the baby shower to present those items to a baby shower.
Ann Kale, Women's Care Center. We do pregnancy testing, limited ultrasounds. We have parenting classes, birth preparation program, and thanks to all of you, we do a lot of community referrals.
Hi, Jerry Boyden. I'm here with Christ Child and the Reading Ranger program, and also I work with Ann at Women's Care Center doing ultrasounds.
I am Jamie Farron. I'm the Director of 211 Services at United Way of Allen County, and we work to get people connected to all of you.
And I'm Dawn Gwiff, and I'm with the Hope Center corner over here, and I just help support these ladies.
I'm Joe Faulkner. I'm the Executive Director of a Hope Center, and we try to do everything that we can to provide hope.
Kathy Wilson with the Hope Center as well.
Diane Hess with the Hope Center. We have individual classes, and we also have group classes. And through those, our new moms and dads can earn diapers and cribs and car seats and all sorts of good things for their little ones.
I'm Katina Roberson from Fort Wayne Bowen office, and we provide lots of wraparound services, mental health needs, and substance recovery for moms, dads, families, lots of things. So also provide supervision for the Early Head Start home visitors as well.
I'm Laura Ottenweller, and I'm a speech pathologist and a certified neonatal therapist, and I work directly with infants and their parents in the NICU.
My name is Shirley Woods, and I'm with the Yule Wilson Center. I got a little nervous when I kept hearing all these health people in here, and I'm going, well, I'm not a nurse, and I don't do anything about breastfeeding. But anyway, we work with inner city youth, and we provide a variety of programs, education. We do spiritual development, life skills, performing arts, and visual arts.
Natalie Stabler. I work in the ECHO program through Catholic Charities. We help young parents stay in school.
Melissa Singh, the Community Services Supervisor and Trafficking Advocate at Catholic Charities. We just offer a wide variety of services to strengthen families.
And hello, I'm Natalie Borjas. I'm also with Catholic Charities. At Catholic Charities, we help provide interpreting and translation services at medical appointments for our Spanish-speaking community.
Did we miss anyone? I think we're good. I'm Laura Dwyer. I'm with the St. Joe Community Health Foundation. I'm not a nurse or a nutritionist, but people think I am every day, so it's okay, Shirley. On your tables, you'll see a purple flyer. It says Vulnerable Population Study. Meg's going to give us an update on that.
Okay, that is a 2 pages summary out of a 400-page summary, just in case you don't have time to read the 400-page report. For today's topic on housing and homelessness, I want to reference just 2 paragraphs in there and set the stage for our speakers. This was a study that we contracted with Purdue Fort Wayne Community Research Institute, who did this study looking at census data over the last 5 years, so it's the most current government information that is out there. But I think it is, I'm going to just highlight 2 paragraphs for you. Under housing, you'll see the paragraph that says, spending more than 30% of the income on housing can make households financially vulnerable because of the share of monthly income consumed by these fixed costs. That's kind of a standard in our country that we use, and most financial planners will tell you. And so all the data kind of rotates from that 1/3 figure. About 36% of Allen County residents who rent spend more than 35% of their income on housing. In contrast, only about 14% of homeowners with a mortgage spend 35% on housing. What that says to us is that in this community locally, we have a rental housing crisis for low-cost, affordable housing. I don't know that that's a surprise to everybody in the room. You're going to get a lot more details about that. I want to separate that from those who are fortunate to buy a home. We're doing very well. So you'll hear certain statistics talk about affordable housing in this community. If you're fortunate to buy a home, we're doing very well. If you're not fortunate to be able to buy but in renting, it's a much tougher issue that impacts many of the people we're serving. If you look further down, that in the 46806 zip code, and a couple of you referenced it, over half of the population, 54.7%, and also in 46803, of that population is spending more than the recommended 1/3 of their household income on housing, which means there's less money available for health care, for food, for education, all the other things. So many of you know this, and we'll get more details on the impact of this, but we want to help educate you. So that's some reference, that's government backed up data if you need that, in addition to a lot of other good information you're going to get in a minute. It's that data that also led us to thinking that this would be an important topic to get everybody briefed on this. But we thought one of the best experts in this community is Denise Andorfer. Denise is the executive director of Vincent Village. She has over 30 years experience serving our local community and is really an expert at-risk and youth and families. Today she's going to tell you a little bit about housing and the impact of evictions in Indiana and on homelessness and on many of the people that you all are serving, because it is truly impacting the health of women and children. Denise?
I'm not sure how much of an expert I am. I think I have this. Are you on? Can you hear? Can everybody hear me?
No, they're saying it. Says it's on, it's lit up.
Maybe I need to talk louder. How's that? Use my outside voice. How's that? It gets my PowerPoint. Well, thank you for inviting me, Meg. We've had a couple conversations about housing, and we continue to need to have more because I was actually at the Institute for Child Poverty and Homelessness conference last year. Has anybody ever gone to that? It's always in New York. It's always in January. Super expensive. I've always wanted to go. Last year was the first time I went, and that's where I was exposed to Matthew Desmond, the author of the book Evicted. So I heard Matthew talk, and I was really excited to hear about the launch of what was called the Eviction Lab. So for the first time in the country, there was data being collected about evictions all over the country. And for the first time, local communities would actually have data to talk and to lend itself to affordable housing crises and what was going on in creating these unsafe situations for families and really being at the underlying root cause of poverty. So Matthew's book was actually, I think, 2 years ago. It's a Pulitzer Prize winning book. How many people have read it? So you need to get the book. If you're with a church, there's actually a study guide for faith-based communities to talk through this. It's really twofold. It talks about a lot of just families that are going through crisis, what happens with landlords. It talks about landlords. But then it also has a national scope of data that's really good about talking about how all the underlying issues of poverty just continue to get people in this whirlwind of eviction, not being able to find housing, not having money for deposits, and it's just this repetitive pattern that I've come the last year to say, it's nothing case management can get us out of, right? We have lots of funded, we have lots of great foundations in the city that fund lots of case managers. Many people in this room are case managers. Sometimes we need a higher wage job, many times, and we also need funds for past due utilities and deposits and those kinds of things. So today in our city, unfortunately, all our shelters are full. We actually have 25 families on any given day that are waiting just to get into the Vincent House Transitional Shelter. And Stasia can tell you that too. That's part of why they started their program, was because there literally is nowhere for families to go in our city. So the Eviction Lab data set was launched last year, and basically pointing to direct cause of homelessness. What was interesting to find, and if you go to that website, you can actually click on Indiana, you can put in our zip code, and what's going to come up? It's going to come up that in 2016, Fort Wayne was number 13 in the nation for evictions. And in Indiana, Indianapolis and South Bend were in the top 20. So I'm no rocket scientist, but if we have 3 cities in the top 20, that tells me a couple things. It tells me that we probably have tenant rights that are not being represented, that landlords are the ones who have the right to their funds regardless of the conditions tenants are living in, and that's actually what's going on. And we also have a problem with HUD and their definition of homelessness. We're going to talk about this on the panel. HUD does not consider families that are doubled up to be homeless. So HUD will say, we don't have a problem. At the PIC count, the end of January, where everybody in the country goes out and counts how many homeless people we have in the nation, we only count 50,000 people. We don't have a problem. Well, the problem is that we have a lot of families doubled up, as all of you know, that are living in unsafe conditions, living with acquaintances, putting our children in danger. Because that is not a safe place, and families go from place to place. We actually had a gal get in Vincent House. She had couch surfed to 9 different spots, both in Indiana and outside. So you can imagine what that was doing to her children and to the overall stress that's leading to compromising our health. So evictions, we know that an $8 an hour wage job in Indiana is not going to get anybody housing. The rate for a 2-bedroom, you need to make $15 an hour. You've probably heard that. The Indiana Institute for Working Families, if you don't follow them on Facebook, they put up amazing data, and also Prosperity Indiana. So Indiana Institute for Working Families will put up data like, in Indiana, you need to make $15 an hour to afford a basic 2-bedroom apartment. And all of that is great information because we know that our wages have stayed very stagnant in Indiana, and even compared to other parts of the Midwest. So evictions stay on people's records. So even in the affordable housing complexes, we're co-developing Bottleworks Loft, and the rule is a 5-year. You cannot have an eviction in your record for 5 years. So if we're evicting 86 people a day, and nobody can get housing for 5 years, we're causing a huge barrier. So the data has finally launched people nationally in cities to come up with what can we do. And Indiana is one of them, and actually there was some information that Laura has, and I'm glad to see the foundation is keeping up on some of the things that are in our own Indiana legislation that have actually come up this week in regards to housing. But this just a little bit of information from a snapshot of the families we work with Vincent Village, but 74% have a chronic health problem or mental health diagnosis. And then 80% of the families living in our Phase 2 rental homes have a past eviction. So it's very common that families are in our shelters that have income. However, they're not able to get a place because of a past eviction. They're also not able to get help with deposits. So the township might pay for some past due, but sometimes the deposits are a barrier. And even in these homes that are not, I call them, let's just call them dilapidated, that people are renting, the utilities are extremely high. So if you have inefficient windows and heating and air units, our houses in our neighborhood were built in 1920, and so the utilities are going to be really high. So even if somebody had rent for $550, their utilities, especially we know people with electric utilities, and they're saying, oh, my electric is, $400 this month. There's also some beliefs that I have to keep my house warmer or my kids are going to get sick. So we have to have that conversation with people, because people just, the old adage, you don't know what you don't know. And we hear things as children, we hear our parents and aunts and uncles say things, and we believe them. But those are things as educators we can get out to the community. So this just talks about our snapshot of people that are at 30% or below of AMI. So it's very hard with barriers such as lack of a GED, chronic health problems. We have 2 families that need organ transplants right now, young parents that need organ transplants. So it's not that people don't want to work. There's all sorts, and we're finding people younger and younger, and health professionals can attest to that are having chronic illness. So we're in a very affordable, everybody, the Midwest is affordable. Fort Wayne's an amazing city. It is. I was born here. I grew up on the South Side. Unfortunately, it's not affordable to be a renter here. The other thing is I just did a presentation with the city, and our occupancy rate for rentals across the city is 96%. So we really just don't have enough rental units for the population. And then the subsidized housing in the southeast quadrant is almost 100% at total occupancy. So again, in the housing authorities here, they can attest to some of the barriers with housing choice vouchers and families trying to go out and find landlords that will accept those. So this is what Meg talked about, families spending at least, many of our families, half of their income on housing, and many, spending as high as 70%. That's actually a national statistic. So our Indiana wages have not increased by much since '79. If you look up the housing costs in Indiana for childcare, it depends on if you look at infants or toddlers, but we are definitely ranking in the top 4 or 5 nationally for childcare costs. Those of you who are paying childcare bills know that. So anyway, and then TANF benefits have not kept up with inflation. What's the year? I think it was 88 was the last time TANF benefits were increased. So the same benefit that was being paid in 88 is still being paid today. So while the cost of housing and childcare, everything else has increased. So these are things that on the state level, there's folks that are advocating, again, Prosperity, Indiana Institute for Working Families. Steve Hoffman is very vocal down at the state level with Brightpoint on advocating for some of these things. Rental laws. So basically, tenants have very few rights. There's actually, Laura has on your information, there was a bill being introduced on Wednesday, I believe it's called Right to Cure, saying that landlords had to get tenants notice in the eviction process of what they owed in fees. And so that just, I was actually texting a friend to see what ended up happening. I'm not sure if you heard, Laura, what happened. I heard that there was also a bill about lease purchase, because there's some scams. Some attorneys have told us about scams going on with, rent to own, where all of a sudden you have a balloon payment in year 2 of $5,000. Well, you've already put money into the house. You think you're owning it. If you can't come up with $5,000 in 2 years, you're out. Doesn't matter how much money you put into it. So there's actually legislation. I saw that passing to continue to go through, but I'm not sure about the notice for the tenants. So sometimes tenants don't know how much they owe, when can they pay by, and often they think that once it's been filed, they don't have any right to go in and pay. So the other thing is only 1 in 4 families qualify for the federal affordable housing programs. So I think in Fort Wayne we have 3,000 people on housing choice vouchers. Is that right, JJ? So while that is great and we need it, we don't have enough for the people that need the service. So it's, again, low wage jobs. Then I hear employers saying, I just can't get employees. We have plenty, factory jobs out there, and we say, well, we can't get people to the jobs. We don't have transportation. They don't have childcare. There's just a lot of barriers. And while we do have a lot of jobs open, we don't always take into account that people with intellectual challenges or disabilities, and we're fortunate the Blue Jacket just put into place a special career program for people, because we find that we have a lot of parents that are right there on that barrier of, between 68 and 70 IQ. They may have, as a child, been in special education. They're really not able to maintain full-time employment, but they're also not able to get disability. So it's, we need more specialized programs to give people skills. So housing assistance programs. So one thing that I've been following is the Institute for Low-Income Housing, and finding out that actually 10 states in the country and 50 municipalities demand that landlords take housing choice vouchers. So in Indiana, we actually have a law that says landlords don't have to take our vouchers. So, and in a national study that HUD actually commissioned on vouchers, it showed that for 40 units listed available, only one was actually eligible. So if you hear people saying, we hear clients that say, I have a housing choice voucher, and we're like, great, and in the shelters, we're like, great, you're going to be moving out very soon, but people can't find landlords to take them. We happen to feel like, because we're advocates for those with no voice in our community, that that's just a form of discrimination. To say that I can't get housing because I make $9 an hour and the government's going to help me with $200 a month of my rent, what I'm paying for, who has the right to say that I'm not going to be a good tenant? So unfortunately, we have a lot of that going on in this city and in cities all over the country. I hear landlords say, we might have some landlords in here, people who own properties, that clients with vouchers are more likely to destroy their house or to not leave their house in good condition. I'm not sure we have any data that supports that. There's landlords that own college campus housing all over the country, and I guarantee you they laugh it off. Oh, those college kids ruined our house. Ha ha, they like to party. But for some reason, it's different when we talk about people that are hardworking and making $8, $9 an hour. Because it seems in this city that everybody wants an employee, right? Every business owner wants that $9 an hour employee. We need a CNA. We need somebody to check us out at Kroger. All those positions don't pay a livable wage. Our employers want them. However, nobody wants to give them housing. And the other thing is that the Fort Wayne Housing Authority and HUD demands that the landlord get the property up to code. If our properties were up to code, we wouldn't have people living in houses full of lead and mold, which are making people sick. So my theory is that, and not well liked by landlords, if you want to do business with human beings, just like if I want to open up a restaurant, I have to have my restaurant inspected, because if I don't, I could make people sick. The same thing goes for housing. If you don't want your house inspected, get out of the game, because right now there's a high profit margin for landlords that buy a house for $20,000 and put a family in there for $700 a month that's full of mold and lead. And we wonder why people are getting sick. But we're allowing it, because the landlord has a right to make as much profit as they want. I say, just like when we passed the smoking ordinance, right? You're making everybody sick. I don't care if it's your right to smoke. If I'm sitting next to you in a restaurant, I don't want to inhale that. And what everybody say? The world was going to come to an end if we didn't let people smoke in restaurants, right? Did everybody remember that? Oh, the economy is going to go down. Every restaurant's going to go out of business. No company's ever going to want to come to Fort Wayne. Seriously, we were one of the first cities, right? Where's my tobacco people? That passed that. So we could do the same with housing if 10 other states and 50 municipalities But first, we have to get the bill off the Indiana books. And those are people that have lobbyists that own huge amounts of properties that are making a lot of money. If we want our residents to be in safe, affordable housing, then we need to up our advocacy in those areas. Because again, the long-term effects of mold and lead are things that people will cause them lifetime issues. So of course we know the poor quality housing leads to all sorts of other health problems. There's even things, the studies that talk about HUD and the assisted households that have elevated blood levels. So we know that families living in housing that is not up to code chronically have those high lead levels. And actually the city of Fort Wayne right now has a lead grant where they're basically telling landlords, we'll pay for everything. Let us come in. We'll test for lead. We're going to pay for everything. We want these houses to be safe. Not all landlords are willing to do that. So the city is definitely doing their part. So we know that affordable housing, children don't have access to, again, just their own room. They leave things behind when they have to keep moving from place to place. Their nutrition suffers. There's just a lot of negative health outcomes. And I actually have a story about a gal that Stasia and I were trying to work with that's a result of a negative now health outcome. So she was in our program. She got housing. She let somebody else live there, move out of state. They defaulted, so she has an eviction. So she comes to us 6 months pregnant with twins. She's got 2 other kids. I'm in a, highly stressful relationship. I haven't been hit, but it's super stressful. I don't have transportation. I don't have a phone. And so, of course, we want her to go to a Mother's Hope. Well, I can't take my other kids. Well, we already have that worked out. So we really wanted to get her into that safe environment. But what happened a couple weeks later, she delivered those twins. And if anybody here is from Parkview, Ronald McDonald, those children were born with serious, serious health problems. They're actually still in Parkview North right now. And that's been maybe 3 months ago. So again, that's, we want to try to get people out of these stressful situations. They had been evicted. They were in a mobile home. And actually, her boyfriend's working, her mother-in-law has disability. They're still not able to pay the rent. So sometimes it's not just about the income. We didn't know where the money was going. And that was her thing. But she's in the middle of this eviction and, delivers these babies that now will have lifetime challenges because of all the health problems they were born with. So that's just an example of how we wish it would have played out. Was very different because we would have liked those babies to be carried to term and been delivered and then reunited, the kids. And with the partnership with Safe Families, we think we could have done that. So educational outcomes, we know that decreased lead exposure, it helps kids learn. We have data that shows improved third grade test scores. And then we also know that kids moving around from district to district, we have families that move in and out of states constantly. So, it's really hard for the kids to get any kind of stability in their education. And we find that most of our kids are a couple grade levels behind in both reading and math when they come into Vincent House. And we're thrilled to have a partnership with Fort Wayne Community Schools, as do the other shelters, to provide licensed teachers to work with those kids Monday through Friday on academics. So lower kindergarten readiness scores. We know we have efforts in Indiana for full day programs, but we know that lots of times our kids are not in the programs. They're not in the Martin Luther King Montessori's. They're not in the Head Start programs are being watched by relatives. And I think last year we had, 3 babies murdered while boyfriends were watching them. So we have a lot of moms in a desperate situation for finding somebody to watch their child. We've had parents, you don't make it to your appointment to get a child care voucher. That's it. You have to go back to square one. And so a lot of our kiddos are in really unsafe environments with very little supervision and really subject to abuse and neglect. We're happy that in conjunction with Brightpoint, we actually have a new Head Start that's opening in our St. Hyacinth Center to serve 75 3 to 5-year-olds. So we need more of those early education programs to get these kids out of the homes to where they're just, playing with toys and really into structured learning environments. Children growing up in crowded households are less likely to graduate high school, and they have lower educational attainment. No surprise. Short-term solutions. So I don't like to complain about anything unless I have some solutions. And I do a lot of complaining, but I got a lot of solutions. So short-term tenant education, and that's something that Meg and I have talked about. What people don't know. We do a tenant 101, maintenance 101. We teach people how to turn off the water. We teach people about what not to put down the drain, how to plunge a toilet. We've literally had people low functioning that just let the water overrun until we have lots of damage in our house, and that's something obviously that would put a tenant up for eviction. And I can't say in any given day I can remember how to turn off my water, so it's something that, those of us who have somebody on speed dial, we can get help with stuff like that. So education, and also when can I call code? If you read the book Eviction, you'll find out that a lot of tenants are afraid to report that they have dilapidated housing because they're just going to get evicted. They have no rights. The landlord can evict them. But we're real fortunate to have Susan Eisenhower taking over as head of city code. I call her a social justice advocate. She's worked in legal housing in other parts of the country. Some people know her better as Mark Levy's wife, who is head of the Cuesta Foundation. But she's a real advocate and wants to talk about doing education for folks on when to call code and what the outcomes could be. Create relationships with landlords to help broker the acceptance of housing choice vouchers. And that's something the Housing Authority continues to look at. Because we're a landlord, we know what they're dealing with. We have a very tight inspection program that's every 2 weeks when people move in, but once they pass, we go in quarterly. But we do know that regular inspections and being proactive is really good. And again, people just don't know. I had a lady that about 4 years ago, I had a HUD inspector here from Indianapolis, and those were the days when we had some HUD funding for housing. So she wanted to go look in one of our houses, so I bring her in, and I walk in, I'm standing there with the tenant and the beeping. Here, beep. So I look at the tenant, I said, oh, what, is that your smoke alarm? I don't know what it is. I've been hearing it for a while now. We keep talking, literally the smoke alarm pops off of the wall, rolls down the stairs, and falls right in the feet of this inspector. And the girl, oh yeah, I guess it was my smoke alarm. So I'm sitting there going, oh my gosh, I have a house here with, batteries that need to be replaced. And since then, we don't just cite, families for not putting in their own batteries. We just put in the batteries because it's important enough that we want everybody to be safe. Working with landlords, I've had a number of landlords say to me, they try to give people leniency. People continue to tear up their properties. I hear people that rent, all over the city talking about the destruction that renters are doing. But how can we create a relationship that's a win-win? We know the paperwork. We know what the Housing Authority might cite us for. And actually, we've had to do some even increased communication in building Bottle Works Loft because there were a couple things that the Housing Authority came in and they said, uh-oh, nope, not these doorknobs will not work. And the property is like, oh my gosh, we just, built 50 units and we have to change all the doorknobs. So it's something that we go back to them and we work out. Not that they're going to change, what a national code is, but their great communication can help us really, just make it beneficial for the tenants, because that's what we're all here to make sure that we have as many families as possible that can go into affordable housing. So we want to be compliant, but we also know that, there are some conversations that might have to go back and forth. And, we're a landlord that accepts the housing choice voucher. And sometimes there's an occasion we think that maybe they're being a little too strict on something. We just go ahead and fix it. So we need to let landlords know that instead of constantly evicting people and have 4 tenants in the house for a year, it'd be better to go ahead and get it up to code, take the housing choice voucher, which will allow people to be more stably housed. People are trying to rent, places for $700 a month on $9 an hour or $8, and they end up just getting evicted. So create eviction prevention programs. So instead of taking people all the way through the process, it's like Monopoly. You get to a certain point, we send them back to start. We pack the shelters with them. They lose all their belongings. And it could have been something, we've had cases, $100. What's keeping somebody from getting to work? Well, I've got a flat tire. Now I'm going to miss work. I don't get paid for 2 weeks. So there's all sorts of small things. It could be cheaper to help people stay in their houses. And we actually had a meeting with Eisenman Properties a couple years ago because when they told us the number of evictions, this is before all the book and Matthew Desmond, but they were telling us how many evictions they've filed, and we couldn't believe it. So those are some broker relationships with corporations. They all want good employees, so that's something else that we want to continue to advocate, and certainly working with the foundations in Fort Wayne who are trying to help those that are experiencing the crisis of being homeless or being housing unstable. So that's it. Thanks so much.
You guys, I think we should thank Denise every time you talk, I learn a little bit more, and I thank you for sharing all of your research and enthusiasm. We're going to allow me while Stasia's getting set up here. Stasia Roth is the Executive Director of A Mother's Hope. This is a wonderful new resource in this community that opened its doors in October. They are a maternity housing program, and they basically focus, they've created a refuge for homeless pregnant women. And they spent multiple years, 3 to 5 years at least, researching how to build a program to be effective. And so this has been a lot of work, a lot of interviews to make this dream become a reality. And so, Stasia, when you're ready, why don't you take it over and explain the work?
Okay. Well, thank you for having me here today. I have to admit, it's kind of surreal that I'm up here right now because I've been sitting out there for years and kind of taking in all the information and learning about all your wonderful programs, and listening to what all you were doing really helped shape and mold what A Mother's Hope needed to do and what we really needed to be in our community to fill this need. Oh, it went fast. Where'd it go? So A Mother's Hope, like Meg said, is a refuge for homeless pregnant women that strengthens their opportunities for stability. I heard Denise say the word stable several times, and I think that's a word that we find ourselves coming back to a lot, is that creating stability, the evictions, all these changes. It's really decreasing that stability, not only for families, but especially for kiddos too. So I'm going to talk a little bit about our program and kind of what we are, and hopefully give you guys a little bit of insight into what we're doing. So Mother's Hope is a residential maternity and parenting program for pregnant homeless women who want a new start. So we have a beautiful house where we are staffed 24 hours a day, 7 days a week, where we provide housing for 8 women and their babies at one time. We also have a program. You know, we hear a lot of times people say, well, are you a shelter? What are you? What do you do? We don't understand. So I wanted to share with you guys that we are a maternity home. That's technically what we are, but we are housing with a program. So when you're talking to folks and you're trying to see if this is something that might be a good fit for them, I'm going to give you the criteria, but we really try to present ourselves as a program and not just housing. We are a home, we are a Christian organization, we are a Christian home, and the way we explain that to the women when they come in is that we operate in our house in a way that we know who we answer to. So we treat each other like that. So we want to just give that mutual respect and love to one another in the house. We are a supportive and safe living environment for them, and we are a goal-oriented program, again, to promote that stability. We do have staff 24 hours a day, 7 days a week. Our staff are awake 24 hours a day. People ask me that all the time, and I say, you know, when stuff's really going to go down, it usually goes down in the middle of the night, so it's always good to have staff that are awake. And we're serving pregnant women and babies don't often conform to that whole we're going to have our issues in the middle of the day kind of mentality. So we want to make sure that our moms can be supported in the middle of the night as well. And even though it's a big house, if there's a baby crying, we all can hear him or her, which I personally really enjoy hearing the babies in the house because it was empty for so long in those 3 to 5 years I was working. So I love hearing the babies cry in the house. Moms don't always love hearing the babies cry, especially the pregnant women who are kept up by somebody else's baby crying in the middle of the night. So A Mother's Hope is the only maternity home in Fort Wayne and the surrounding area. So the closest other maternity homes to here are Hannah's House up in Mishawaka, and then in Carmel, Indiana, there's the O'Connor House. So there's really nowhere in our area in the surrounding counties that is specifically housing and serving pregnant homeless women who are, and also when they're postpartum. So Joy earlier mentioned our different, oh, it missed one. Apparently it doesn't want to show that one. That's okay, I can do that one. So the one that it skipped it. Anyway, so that one talks about the need for a Mother's Hope. I'm pretty sure there's nobody in here in this room that would say we don't need housing for pregnant women, but just in case you need me to prove it to you, I'll tell you some of the statistics. So back in 2016, there were actually 81 pregnant women who called our local 211 looking for shelter. And then in 2017, there were 171 pregnant women who called 211 in Allen County and the 19 surrounding counties. Again, that number was 171. We can house 8. So there's a huge discrepancy in those two numbers. But what we've found is that there are so many different reasons, like Denise said, that you may find yourself in need of housing. And so we're going to talk a little bit about that in a second. But I really wanted to share with you guys, as we were building up A Mother's Hope and when we were planning it and we were putting all this effort into creating what was actually needed in our community, it was really important that we create a program that was fitting that need for the housing, but involving as many of you as possible. So I was kind of laughing as you all ran around. I'm like, yes, that person's been to A Mother's Hope, that person's been to A Mother's Hope, and just how many of you have been involved with what we're doing. But no one was doing the housing just for pregnant women. So that's our piece of the puzzle and where we fit into the community. So our program areas are shelters. So of course, we're providing shelter for them while they're at A Mother's Hope. But we're also looking to where do you plan on going afterwards? And so we're always constantly from that first day that they're there trying to figure out how did you become homeless? How did you come to need A Mother's Hope? And what can we do to help support you as you're looking to where you're going to be going afterwards? Honestly, that looks different for each and every woman that we serve. Their needs are so unique and so varied because they all came to us through different situations, through different environments, and what they've experienced is so different from what the person sleeping in the bed across the room has experienced as well. So we want to make sure that 8, it may not sound like a big number, but the potential impact is huge because we can focus on exactly where they've been and where they want to go. So second is health of mom and baby. There's a lot of health professionals in this room. So we're seeing health of mom and baby includes everything you can think of when you think of health. So it means helping make sure they do have their insurance, making sure that they're getting to their prenatal appointments, answering a lot of questions about pregnancy and about postpartum, and helping them get those questions answered through so many different things that we provide at A Mother's Hope, and then things like that we have the community coming in and working with them as well. So we are providing parenting education through Women's Care Center comes right to A Mother's Hope and provides that. One of their staff comes to A Mother's Hope and provides parenting education. We have our Earn While You Learn program so that they can see videos. Everybody learns through video now, right? So have videos that they can learn about that. We also have nurse midwives that are coming to the home and talking about pregnancy and talking about what to expect. We had a really fun night where actually one of our board members is a certified nurse midwife, and she came in and did a Ask the Midwife Anything. That was crazy and so much fun. And I'm kind of sad I wasn't there for it because it sounded like it was really a great time. But they got to ask her literally anything they wanted, and they got answers to a lot of their questions. So also health also means baby as well. So making sure that mom is following up with baby after he's or she is born. So I'm going to show you some pictures of the babies a little, if I have time later. So I'll talk about that a little bit. Education. So initially we want each mom to have at minimum her HSE when she comes in. At this point, 100% of our moms have had either a high school diploma or that HSE. So what we're looking at with education with those moms in particular is seeing what do they want employment-wise and then trying to get the education to match. So one of the beautiful partnerships we formed is with Ivy Tech. We're very close to one of the Ivy Tech campuses, and we actually have an individual that comes to A Mother's Hope periodically. Right now she's coming like once a week. Because she's working individually with each of our moms, not only on financial aid, what do you want to do? There's so many certificate programs out there. You can do 13 hours and potentially have a paying job that's going to be more towards a livable wage than that survival wage. But many of them don't know that that's even an opportunity, or what would that look like. So she's coming to A Mother's Hope, which eliminates that barrier for transportation, and sitting down and talking with each of them. And they have a really good time because they're right outside my office, so I can always kind of hear all the things that are going on, and Tracy's outstanding with them. Employment. Again, back to that, moving them towards from a survival wage to a livable wage. But one of the greatest barriers that we find to employment is their pregnancy. So almost all of the women that we have had come to A Mother's Hope are experiencing a high-risk pregnancy. And so we have several women that are not able to physically work right now because of their pregnancy. So what does that look like? So we do have a productivity requirement within these program areas of things that they are expected to be productive for 40 hours a week. So we're trying to prepare them for what that's going to look like when they're actually working in the community. So if they're not working in the community, their productivity needs are met more at the house. So we have that structure in place during the day to help them reach those goals. And talking about employment and those kinds of things is one of them. Support's a big one. So support can mean a lot of different things. One of the things it means is we have Headwaters Counseling comes right to A Mother's Hope and provides counseling individual to each of our women. And then in addition to that, we're looking at adding some additional groups that they're going to be coming to A Mother's Hope and providing those services as well. But support also means 24 hours a day, 7 days a week. There is a staff person that is present at A Mother's Hope for whatever's happening in that moment. So in the middle of the night, baby won't stop crying. They don't know what's wrong. They're trying to figure it out. There's a staff person that they can go, here, can you please help me? I have no idea what's going on. Also, like I said, it's a big house, but you can hear them crying. Staff can go up and ask them, so what's going on? We also have 100% of the women who have come to A Mother's Hope have identified as having depression and anxiety. So we have a large mental health component that has kind of rose out of the support part of our programming. So we do a lot of talking with them, helping them get through a panic attack, helping them through seizures, back to the health. The women that we are serving are those who definitely need those services the most. It is a very intense service. The last one is life skills. I actually always say this, and usually she's not in the room, so this is kind of funny, but I always say one of the first times I went and spoke to Ann Kale at Women's Care Center when we were working on organizing A Mother's Hope, as I said, and tell me, what do these women need? And she said, Stasia, they need life skills. I don't know if you remember saying that, but she did. And so that was always a part of our program from the beginning, is having those life skills components. So a lot of the things Denise talked about, how do you, not clog the toilet? Simple stuff. How do you clean a bathroom? How do you cook? Our moms take turns cooking dinner. How do you go to the grocery store? One of our staff takes the residents to the grocery store, and sometimes she takes a bunch of them, and apparently that's quite the adventure. But then they can learn how you're getting things, how you're doing things, learning that budget for the food. We actually call that our HOPE program, which stands for How to Outfit, Prepare, and Empower. So how to give them the tools for this is what you need to get the job done. How do you prepare them for what they might expect? And empower is how do we teach them that they're worth all this effort? So applicant criteria. If you're working with a woman and you want to know if she's eligible for our program, these are our criteria. I also have little cards that I brought that are on the back table that you can get that have this on there as well. Number one, is she pregnant? Is she homeless or at risk of homelessness? And our definition of homelessness is not the same as HUD's. And ours is that they have safe, consistent, adequate housing. Actually, when we did the PIC count, none of our moms qualified. So we tried. We tried to participate, but we couldn't because none of them qualified for it. So that point in time count that Denise was talking about how we count the homeless in our city, our women, none of them qualified for that. So they have to be willing to follow the rules and structure of the home, willing to participate in the program, including the individual counseling component and the productivity requirement. They have to be committed to living drug, alcohol, and tobacco free. If they are smoking, we just want them to say that they're committed to try to quit, and then we will help them get that into place. If they are using, they drug test them when they come in. I'll say that in a minute, but that positive drug screen doesn't automatically mean that they're not eligible for our program. It just kind of depends. Income is at or below 150% of the federal poverty guidelines, and those are our requirements. Like I said, they're back there. You can also find them on our website. We put the rules and structure of the home and the willingness to follow the program because we want to make that clear up front to the women when we're talking to them about our program. We want it to be a good fit for them too. They may be coming to us because they need housing. That's typically how that referral starts, is this person needs housing. But we want to share with them what our program is, what it looks like, what it all entails, so that they know it's a good fit for them too, and they kind of know what they're getting themselves into, because our program's pretty intense, and we want to make sure that's what they want. We have had a few people that, we've done the intake, and then they just kind of fell off the face of the planet. And so that wasn't what they wanted in that moment, and that's okay. We want to make sure we're getting the services to the women who do want that. So our intake process. There is, Joy's going to pass it around for me. I have some sign-up sheets. If you would like us to email you one of our applications, just so you have it on hand, we'd be happy to do that for you. And you can just put your name and email on that list, and we'll get that to you. You can also call an application in. That's our main number. There's also a number on the website. They both ring the same phone. Doesn't matter. We are not an emergency shelter. So that's one thing that we have encountered. So we do already have an emergency shelter in our community with Just Neighbors. So when we get the first call or the first email or whatever, what we do is contact whoever made that referral. So if it's coming from you, we would contact you. If it's coming from a young woman, then we would contact her. I would really encourage you all, if you can, if you're working with somebody and they want to apply for our program, it is so helpful if you guys call us, email us with kind of the application, or even just kind of a, hey, heads up, this young woman is going to call you, she's interested in your program, and then encourage her to call us so that she's taking that step to actually contact us. We've seen a huge difference in the follow-through on the applications of when the woman actually calls us herself. Then we usually go meet with her in the community somewhere. So we try to make it really convenient for her. We've met at McDonald's, Dunkin' Donuts, wherever, just to make it convenient for her. We'll go to wherever she is. Myself and our family resource coordinator, Joy Tiernan, go to those intakes. And we meet with her and we go over just some general questions. A lot of what's on that application, we're going to talk about it again. Ask her if she has anybody in the community, anybody that can be a reference for her. It's very helpful to us to understand if they say, most of them say, I can't think of anybody. They say, I have nobody that can vouch for me and say, I could do this program. That helps us understand a little bit more of what this woman's experiencing and where she's at in that moment. And then we follow up on if they do have those references. We do check for warrants and those kinds of things just to see where they're at. And then we do the final intake at A Mother's Hope. And if they can't get there, we'll help them get there. So these are kind of the questions that I get asked a lot. People ask me, can other children stay at A Mother's Hope? Unfortunately, they cannot. As silly as it sounds, it's a zoning thing. They wouldn't let me have more people in the house. So the home that we own, like I said, it is very large. It's on North Clinton. It's a large, beautiful 4-bedroom home on 5 acres. Unfortunately, they will not allow us to have other children. But like Denise said, when that happens, we have some things in place. We have a good relationship with safe families. If mom is willing to allow her children to be in safe families, for that woman in particular, that looked like that was going to be the best plan. That's not how it played out. Also, often maybe grandma would be willing to take the kiddos, but she's not willing to take mom because mom has burned that bridge. So there's like some different things we can do. We like to think outside of the box. The kids can come and visit. As much as we can maintain that relationship, we would want to help them do that. Drug screen, like I said, is given an intake. We have had situations where that drug screen was positive. We still allowed them to move into A Mother's Hope. However, they might have additional requirements placed on their agreement to stay with us. So they might be required to go to Narcotics Anonymous so many meetings a week or different things like that. So we really want to get these women in as much as we can and then really be able to help them and serve them. Residents may remain in the program for up to 1 year after the birth of the baby. However, most of the women will probably stay approximately 7 months in total. I don't have our own data on that yet because we haven't been open long enough for me to tell you how long it's going to be for us. But that's what other maternity homes in the country are seeing, about 7 months total. So they come pregnant. They're not going to probably stay for a year. But for some women, it'll take that long to get some things in place so that they can move out into a healthy situation. We do not have an age limit, but residents under the age of 18 do need parental consent. At this time, we have not had any women under the age of 18. So a little bit about the women that we're seeing, that we're serving. We really recognize at A Mother's Hope that each woman is unique in her needs and how she came to us. And the beauty of our program is it truly can be molded for exactly what that woman needs. So we focus on those 6 program areas, but we do it in whatever way they need that. So a little bit about what's happening now. So since October, A Mother's Hope has received about 30 applications. I think it might be over that for our program. We have served 9 women and 3 babies total at the house. Today we have 6 mothers. I almost want to say 6.5 because we took a call on the way here and I think she's moving in either today or tomorrow or Monday, or we're not really sure, but I think she's moving in soon. So I feel like we should get like a half for that. We've had 1 resident that actually transitioned over to Vincent Village. She probably moved on a little bit sooner than we would have preferred for her, but she was very excited to go into that program. We had another young lady who her housing came up, so she was able to move out with her baby. And I have some pictures of them here because everybody loves pictures of babies, right? So this little guy, the 2 on the left are the 2 that have moved on, and the one on the right, I took that 2 days ago, and she is 8 days old. And right now at the house we have the 6 moms we have 3 boys and 3 girls, so they're all like, who's going to be the tiebreaker? But the little guy on the left, when he was born, both little boys on the left, actually, neither of them were thriving. Both women had been malnourished while they were pregnant. And when they were both born, they were struggling. The one on the left more than the one in the middle. The one in the middle, I was actually there when he was born, and he drained a whole bottle right after he was born. Like he hadn't even been around for more than a half hour, and the whole thing was gone. I was like, oh my goodness, I can't believe he ate all that. And he was doing excellent. The one on the left was a little bit more of a challenge. This mom had great intentions of feeding him, but she really struggled and could not track when she had fed him and when she hadn't. So we really had to get on her. And I am happy to say when he left A Mother's Hope, he was thriving and gaining weight. We aim to have healthy moms and healthy babies at A Mother's Hope. we don't only want to address their physical needs, because we know that if we're only addressing the physical needs and we're not recognizing all the other things that play into that, of their spiritual needs, their mental health needs, all those things, that we're only giving them a place to stay, and we want to be more than that. So we want to provide them hope. A mother's hope is all about hope. We want to provide them a hope for something different, something they may not have considered that they could ever accomplish in their lives, and help them find the steps in order to do that. Thank you.
So Denise is going to come up and talk to us a little bit about Vincent Village, but I want to just take this moment to reiterate how important it is to work with legislators and how important it is to be an advocate and do advocacy. As we know, a lot of our pregnant moms smoke. They also bring babies home into smoking environments. It's so detrimental to their health. So support the cigarette tax. It's proven it will help. I also wanted to give you the rundown on Senate Bill 422, which Denise referenced. It's promote housing stability for renters through a 10-day right to cure, cure being C-U-R-E. Currently, renters who have fallen behind on their payment are not provided a notice for eviction or a 10-day right to cure, which means to fix, I'm assuming, unless they have an oral or informal lease. So who has one, right? That leaves the majority of renters who have fixed-term formal leases behind. So that takes away all their rights, and they can be evicted tomorrow. I can give you 24 hours, if I'm understanding that correctly. SB 422 would provide both landlords and tenants a better tool to avoid evictions by ensuring the eviction notice and right to cure applies to all leases. So something to support. SB 422, it's in the House right now, or it's in the Senate right now. So thank you. Denise?
I see a lot of partners in the room, but for those of you that don't know about Vincent Village, we actually provide 2 transitional housing programs. We have been in our mission statement, shelter care advocacy, affordable housing, and supportive services. So like Stasia said, it's a program. It's not just a bed or a home. So we opened in 1989 in the old St. Hyacinth Catholic Church convent. It was a community collaboration of the bishop and Trinity English Lutheran Church and some other churches and city council members that realized we had empty spaces in our city that we could use for homeless families. So we've been in the St. Hyacinth campus taking over the community center that used to be occupied by Catholic Charities, used to be the Children's Cottage in there is where we're moving the new Head Start. So in 1996, we began our CHODO, our Community Housing Development Organization. So actually we have 2 501c3s. The CHODO allows us to utilize city home funds to acquire rehab housing. And the goal was for the families that are in Vincent House to have somewhere to move out into. So that was the problem. It was great to serve the families in the shelter. However, there was limited places for them to move out. So we thought, we'll just create our own housing. And we're fortunate to have some of our founders that helped us do that, and we created the CHODO. We have, in the past, we've rehabbed 27 of our 35 rental homes with using either state or city home funds. And we're currently co-developing the Bottle Works Loft at the corner of Pontiac and Anthony. There'll be 50 units. There's 19 brand new houses, 31 apartments in the historic Bottle Works building. So we will be the supportive service provider. We won't be case managing, but if clients need, we'll have a monthly meeting, whatever clients need in the community, referrals for classes, food bank, the township services, and a lot of your programs we will have there available for the tenants. The Vincent House actually is what our name used to be many years ago. For those of you that remember, our shelter houses 10 families at one time. Every family gets their own bedroom. We have communal areas for kitchen and bath. We follow the chore. Everybody does chores. I like to refer to it, for those that know, the Waltons meet the Marine Corps. So it's the loving family style, but lots of rules, because there's only one way you get 10 families and 35 children to live peacefully together as if you have lots of structure. So that's what we do. And again, all families share some common spaces. So qualifications to get into Vincent House, we only take families, but we do take families that have fathers, which is really important for our families to be kept together during their crisis of homelessness. So we take also single dads. We had a single dad come a couple years ago all the way from Louisville because nobody would take a man and his children. And again, we're considered transitional. Just Neighbors is considered emergency. So by HUD's definition, people could stay with us for 2 years. However, our average length of stay is about 4.5 months. So we know that the longer people stay in communal living situations, the more they might become depressed. And again, if you're living with your entire family in one bedroom, it's pretty stressful. So our goal is to get people get to the root of their issues, whether it's chronic health problems, mental health, lack of employment, lack of transportation, childcare. What are their issues? How can we get them healthy and get them out into housing? So again, there has to be children involved. It could be a pregnant married couple, but there has to be children. If DCS has taken the children, we have to have a letter of reunification happening in the next six weeks. So we have 2 waiting lists. We have a shelter waiting list from the Y, Just Neighbors, A Mother's Hope, and then we have a couch surfing, I'm living in my car list. We prioritize the list for the shelters just because it's a pipeline. Once we free up their beds, they can take more families in. And then we have another list for people. Again, we get calls. People are in motels, their houses are being condemned. Relatives call, they've been, sleeping in my family room for a month. So we have a second list, and we acknowledge that they are in a crisis of homelessness despite the fact that HUD does not count them as homeless. So their income cannot exceed the AMI. So we look at that. We also have a background check. No violent felonies. Again, we have people exposed to children. So we do not only warrants checks, but we do other background checks to make sure that nobody is putting any of our families at risk. So the other thing, just like Stasia said, we also have 24-hour staff. We have staff also up all night. Every day of the year. And our staff, because we have 2 floors, our staff actually walk every hour to listen for those crying babies, people that might be in distress. We just had a mom a couple weeks ago tell us her physically feeling so bad. She literally came out of her room with her 18-month-old and handed her to our staff before she said I was going to hurt her. We have parents that don't feel good. They have chronic health problems. They have high blood pressure. They have diabetes. Our nurse, Amanda, can tell you all the chronic health problems our families have. We're blessed to have the support of Parkview Community Nursing, and they work really closely with us to help our families with the health problems. One of our requirements is that you have to be clean to get into our program. We changed that about 4 years ago because it seemed like we chronically had people continue to use as well as to use alcohol. And it was creating an unsafe environment for all our kiddos and for other residents. So we went to a 0 tolerance. So we don't even tolerate alcohol. We have a breathalyzer. We feel like our program is totally supported by private dollars. This is an opportunity for you to fulfill your potential, for you to take this opportunity as a part of your journey, but to reach your full potential. We have some great treatment programs in the city, but we are 0 tolerance. So that occasionally does allow for people to have to come back in 30 days and retest. And then if you're a current client and you test positive, you have 3 days to exit. And so we really don't have that many people testing positive because I like to say once you set the bar for people, the chances are they're going to meet that. Unfortunately, a lot of times we set very low expectations for people. Our Phase 2 rental home is the program that a lot of people don't know about. So this is our 37 units in the community around our campus. And those are regular rental home agreements. Those are only for families that are in area family shelters. CARES, Just Neighbors, A Mother's Hope, the Y, Hope House Transitions. And so that housing stock is specifically for those people that have the barriers of eviction, have lower incomes, could have a chronic health problem, but they still need a lot of supportive service. A lot of times, I'm not a big proponent for all families of the Housing First model because just simply putting somebody in a house does not magically solve all their problems. It possibly can make them open, but we find that by getting them, I like to say it's like having grown kids live with you in the Vincent house. So it gives us a chance to watch parenting, to intervene when parents are getting frustrated, to say, oh, you're giving a breathing treatment to this baby and we're noticing that he's actually passing out because he doesn't have the right dosage. So it allows us to, I guess, do a little parenting and really good case management, grandparenting with the 10 families that live with us, so we can really be there to give that support, because that's the underlying issues, that families don't have support. They don't have anybody to call. They're isolated from girlfriends and relatives, and they become very lonely and depressed and have a lot of anxiety. So the Phase 2 rental home, again, they have to be clean on a drug test, no violent felonies, and they have to agree to abide by the rules of the program, which are ongoing random drug testing, as well as a minimum of monthly case management with goal setting and budgeting. So we're real rigorous. We start inspections very quickly. We don't allow people that aren't on the lease to live there. It happens that the love of your life just pops back into your life once you have a nice 3-bedroom house, and it's really funny how that happens. But we're pretty smart, and that's a good thing about having all the houses in the neighborhood, because we're able to do a lot of inspections and follow through with a lot of good requirements for our families. So, and again, just like A Mother's Hope, we have lots of education, lots of partners on site, lots of collaborations, not only to work with our parents, but to work with all of our kids. So many of you are partners, and we greatly appreciate it. And we're ready for the panel.
Yes. And then Paige, I think you're going to join us up here. We're going to have you guys pass the mic.
Sounds like a singing competition. I'm kind of nervous.
Do you mind introducing yourself so you can see others?
Yeah. My name's Paige Wilkins with Healthier Moms and Babies. I'm the director there. Many of you know who we are, but we provide prenatal health education and services to women who are at risk of preterm birth and a poor birth outcome. We have several programs. We have a prenatal home visitation program, which utilizes case managers, and we provide weekly, biweekly, or monthly home visits, working with moms to achieve goals, to make changes during their pregnancy, to have a healthy outcome. We have our Nurse Family Partnership Program, which is a national evidence-based home visitation program where nurses are paired with a first-time Medicaid-eligible pregnant women until the baby turns age 2. We also have our Baby Me Tobacco-Free program, and that's a evidence-based smoking cessation program for pregnant women. I'm just so proud of that program because last year was our first year implementing it, and 84% of our moms who entered that program quit and have stayed quit smoking. The national average is 60%. So that it's just an amazing program. They get diaper vouchers. They have to do a CO test every month, and if they are negative, they get a $30 voucher to Walmart for diapers or wipes. If someone is interested in that, they don't have to go into one of our prenatal home visitation programs. They can just do Baby Me Tobacco-Free. And we also have a Mama Mood support group, which is really underutilized, but it's every Tuesday night at between 5 and 6, and it's really geared towards women who have depression, anxiety, postpartum depression. My staff person that facilitates that, she has been trained through Postpartum Support International, and we provide transportation through CTN.
Very good. I think this is on as well. We have some questions that we think will help you, that we're going to hopefully not stump the panel, but we will get some more information. first question we have is, what are the definitions each of you use for homelessness? And you're going to pass the mic and just kind of give question.
Well, if someone is living in a car, if they're couch surfing, that's really how we define homelessness. We look at how stable their housing is, if they have a chance of being evicted. We even take a look at their environment, and if their environment is extremely unsafe, where there's mold in the home, maybe infestation of bed bugs, that kind of thing, we even take that into consideration for being on the verge of homelessness.
Like I said, we define homeless or at risk of homelessness as not having stable, adequate, and consistent. So ours also encompasses a lot of the things that Paige talked about. We have a lot of people that they may be housed at this exact second, but they know that consistently that housing is not going to last, or they're about to lose it, or this person's kicking them out, so that kind of thing. So we really wanted to have a definition that we could include many of the scenarios that we were hearing were occurring.
We do also have that same definition. We do not receive HUD dollars any longer, transitional housing and all supportive services for, excuse me, families in transitional housing. We're cut by HUD. We don't receive any emergency shelter money from the state of Indiana. So we can have a definition that fits in the best interest of families, which is acknowledging that people that are couch surfing or in motels or in unsafe environments can qualify.
Okay. I think you all may have addressed this, but does anybody else want to add anything to how you screen for homelessness? I think Denise and Stasia, you kind of mentioned it, but if there's any other thing you want to have on that?
It's part of our intake process. We just ask and talk to them about it. We might not necessarily get the most truthful answer at time of intake, but that's the power of home visiting. When you're visiting somebody in their home every week, you learn, and they might not admit it at first that they are couch surfing, but it doesn't take long once you develop that relationship and being in the home to find out.
Okay. I want to just comment, we haven't said it directly, but in November, Holly Seabury presented on the Center for Disease Control's research on safe, stable nurturing and how important it is. And this is all, I keep hearing again, safe, stable housing. And that's kind of the background theme. Could you all comment on what are the resources out there for any, it could be pregnant women, new moms. This is a room full of people working with new families, pregnant women who may be at risk. Where do they go? Where do they start? We've given them 2 resources, but can you give any advice on that?
Well, they can definitely call 211, and I know Jamie's out here, and she's going to love that. Actually was on hold and emailing her the same time last week looking for a bed for one of the gals in Bottle Works that has relapsed. So, and actually I got to find out about the LIFT program to treatment. So always interesting, amazing things going on in the city. But we definitely, our clients, we refer folks to the township. So for our Phase 2 rental home, our landlord follows through with eviction, just like the same for everybody, because if we allowed every person that had an emergency not to pay their rent, nobody'd pay rent. Everybody is in constant influx of employment and health issues and other things, but we do, our social workers then get them over to the township. Township is a primary resource with that denial letter, Broadway Christian. So there's a number of places that we've even have a gal that needs a kidney transplant, and the local kidney foundation through their national office paid one of her month's rent. So we get really creative when we try to help people stay in their housing.
The same resources that Denise just mentioned are the resources we use. Kara's House. It's just neighbors. I have a hard time saying it's just neighbors. I still call it what it used to be called. Yeah, Interfaith Hospitality Network. But just neighbors, we use the township trustee to get that denial letter. Once they get that denial letter, then we'll refer to Salvation Army, Catholic Charities, Lutheran Social Services, even Broadway Christian Church. Wellspring sometimes does some emergency. But those are probably our biggest referral sources. That might be another question.
Okay. I was just going to say, when they come to us, they've already done all those things a lot of times, and they didn't work. So the women are coming to us in a little bit different of a situation. But I was going to say, I think the greatest thing that we've seen is if we often get them if they weren't able to do those things or they chose not to follow through for whatever reason. So I think that there are a lot of resources available, but what we're seeing is for one reason or another, either the women that we're serving didn't know that those things existed or they chose not to follow through with them, and that's how they're ending with us. So I think and maybe I know Denise probably experiences a lot of that as well, but that's kind of our perspective on that, I think.
Okay. I want to say that there's some great resources in the room so that if you want to add something to the panel, please let us know if we're missing something out here you think the room would benefit from hearing. If you're a home visitor, you can observe some things, but when you are not with them in the home and you're questioning them to figure out if they are in that safe, stable environment, what are some of the questions you are using?
So some of the questions that we are using when a woman comes into a Mother's Hope and we've already determined that she is homeless. Do you mean to determine that, or we're back to?
Either to determine it or for people to try to assess.
Okay. So one of the questions that we ask, we found that if you're going to ask somebody, how many people do you have any support? Support can translate to a lot of different things. I bet if we asked everybody in this room, everybody thinks support means something different, although our definitions may be similar. So we ask people how many people they have in their lives they can trust. That is very telling when several of them have said no one. That helps us understand kind of where they're at and where they're coming from. If you literally have nobody that you can trust, and that's a very different situation from, do you have any support? And they're like, oh yeah, I've got tons of support. So we do ask them that. We ask we ask on a scale of what kind of hope they have for their future, and we put a value to each of those comments, so like a 1 to 10 scale. And then we also are asking them about how they feel about themselves. Those kinds of questions have led us to a lot of information, so it doesn't just give us the information about what we're actually asking, but it actually helps them open up as to what other things have been happening and going on as well.
We ask those same questions. The other question we ask is how many times in the last year have you moved? Because that gives us an idea as well.
We also use other assessments that help paint the picture. So sometimes it's very hard when you meet somebody to really understand what journey has happened in their life, but we use the ACEs as an indicator of how much trauma they have had in their life. And then the Family Self-Sufficiency Matrix will give us a score on, I have no transportation, I have no GED, I have no support system. And once we paint that, picture, we can really help them make that plan, because often there's multiple barriers, and then when we find out there's a past eviction along with that, we realize that it's really going to be a process to try to get people stably housed.
Okay. If someone is living in a lower quality housing, you said dilapidated was a great word, but that's all they can afford. How do you suggest they can be assisted to avoid eviction? How do they properly clean, maintain a safe, healthy environment to stay in compliance with the rules? How do you handle those?
That's a really tough one. I would say that calling 311 as a tenant, asking about code. I should tell Susan I gave everybody here her home phone number. That'll give her a chuckle. today because she's my neighbor and say, just told everybody just to call you. But calling 311, inquiring, Susan and I have talked about doing some educational sessions throughout the community on when you can call code, what do you call for, do you have to let them in your house, what are all the issues surrounding with dealing with neighborhood code. There is definitely a need for, you can't use your food stamps for trash bags and cleaning supplies and those kinds of things. So it's really unfortunate. Of course, it's for food, but for other entities to have those things, we have a store that people earn points, and having those household items are things that we always have in there, trash bags, cleaning supplies, all those things. But as far as education, I think there's just a gap in what people know, what they've been taught. We have lots of tenants that only through inspection we see food that's literally been sitting out for a week, and the food safety, how are you attracting rodents, because we have a lot of kiddos with allergens to the feces of these mice and roaches and things. And so we literally always are coaching people on the best practices in trying to avoid that. But again, if you grew up in that, that's what you know to be normal. It just takes some coaching, and also addressing that in mental health, because hoarding and some of those other behaviors are linked to depression and anxiety. So, but we know that those are controllable things in people's house that they can do for their kids, as far as keeping them clean and not letting them to be filled with, rodents and pests and things that are health hazards for the whole family.
We do a lot of the same things, like Denise mentioned. We do a lot of coaching. If there's a house that needs cleaned, has a rodent issue, anything like that, we do try to get them to some resources in the community, so that they can possibly get the cleaning supplies to clean up. When we do screenings for depression and anxiety, usually when there's a hoarding situation, like you mentioned, there's depression or anxiety that's impacting that. So we like to refer to Bowen Center for mental health. And one of the reasons why we really like Bowen Center is they have wraparound services, and a case manager will come into the home with them once a week and provide life skills, which is a great resource. We do goals with them. So if we notice a trend every week that there's trash in the kitchen, dishes need washed, we'll set up goal plans with them to teach them how to do some of those life skills. And then if we come back the following week and it's cleaned, we'll give them a little incentive item. As far as the dilapidated houses, that's just a huge concern, the lack of responsibility that landlords take. There is none. We've tried to make several reports in the past, and then when you do that, then there's always a chance of eviction. But some of our moms are really living in awful living conditions that have mold, infested with bed bugs, major water leaks, and what we try to do in those situations is get them out of that housing.
So I can speak to what we're doing at A Mother's Hope, so that when they are leaving us, they're learning some of those things. So part of the beauty of our program is because it is in a home, we have to take care of and maintain that home. So as we're taking care of that home and maintaining that home, we're showing them what we're doing, and we're involving them as much as possible. So when I walk into the kitchen and the sink is running and I ask them why, and they're like, oh, we don't know why, it just won't turn off. It's like, okay, well, we're going to figure it out. So we go under and we take the pipe and we reattach it, and this is how you do this, and they see those things. We're also in the process of bringing in another individual to come into our home and teach some of these maintenance things. So he's done a lot of different maintenance in buildings all around Fort Wayne, and he's kind of an expert on that. So he's going to come in and talk with our moms about some of those different things that you do to maintain a home. Simple things that you can do so you're maintaining and kind of heading off those problems and those issues before they happen. We have a lot of conversations with our mothers about life skills. That's one of our main responsibilities that we're always constantly teaching. We have found we have such a range, which is often very frustrating for the women because some of them come in and they know how to clean and they know how to do these things and other women don't. So constantly having those conversations and staff working with them on the food safety, on all those things of, hey, this is sitting out, we're all right there. So we all work together on a daily basis to be teaching these, not only maintenance, but life skills and just all the safety issues that can happen.
Do you want to do the next one?
So talking about safe, stable homes, in your opinion, would a curriculum, if someone developed a curriculum to teach really how to maintain a home, like providing smoke-free rooms, cleaning and maintaining the residence, washing clothes, other personal items, that type of thing, trash, disposing of trash, right, and keeping it clean, fixing basic household issues and reporting major needs repairs, avoiding common causes of evictions and knowing the rules. Would that help our community if we developed somebody in this room, not saying who yet, but would develop that type of curriculum so that we can help them with those life skills and maybe help them stay in a home instead of getting evicted?
Yeah, when I read that question, I was thinking, that's a really great idea. That would be wonderful. I think my first thought is that does sound wonderful. It sounds like a lot of different details that definitely make sense being put together, and it sounds like something that our community could definitely benefit from. Again, I don't know who's best to do that. I think that that's something that we've developed in our own house, but we're reaching those 8 women at one time, but it definitely could be something that could be community-wide and that the community could definitely benefit from.
I think it's a great idea, especially if it was developed for the entire community and we can be giving a consistent message, because it doesn't matter if they are going to Women's Care Center for parenting classes and we're in the home, and then they are maybe going to Head Start. But if they're hearing it a couple of different places, it's just going to reinforce it. I think it's a great idea, especially if the curriculum was designed in a really user-friendly, easy way for our clients to understand.
Yeah, we definitely would agree. When we teach a maintenance 101 to tenants moving into our phase 2 program, we find that people are like really interested, appreciative. They always wondered how these things work. They don't know when to call a work order, and so that's repeated education on just like they would in an apartment. Your toilet's leaking. We actually had an $800 water bill on our duplex, which unfortunately for us, we pay the water bill, but we had a tenant that heard it running and she saw water around the toilet and wasn't paying any attention, and sure enough, we had this huge water bill. Of course, we haven't evicted her for that, but just those kinds of things where you can teach people about what to look for and when to call their apartment complex. Unfortunately, some of the landlords aren't, going to come out for various calls, and we've had people move in where the landlord actually had a leak in a water line, and the tenant got stuck with a $900 bill because of the landlord's inability to fix it. So we think it's a great idea to have continued education and also to work with code. And the Apartment Owners Association has developed some tenant rights material that we're working with them. So we do a certification, a good tenant certification and a maintenance 101 certification. I don't know if landlords or anybody would care, but I think we would all find value in knowing we've provided that education to folks, and it was, in a set community-wide curriculum.
Then if you all think this, and we had gotten some feedback before in preparing for this, that actually it might be good to put together a committee to actually work on building a curriculum that could, and figure out how to best deploy that into the community. I want to open it up if anybody in the room is interested in working on that with us. Please let Laura Dwyer know. You can let me know, or anyone who's on the PIC advisory
board, and we'll kind of put together a group who could take a look a little bit longer at how could we get some common curriculum going to help people, the housing that they're in, make it more affordable, safe, and stable. Are there any other questions in the room that you would like to ask the panel?
So just by a show of hands, how many either work for or with shelters, temporary shelters, Fort Wayne Housing Authority, all of that? We have a special guest, John Wolf, and I just want him to tell us briefly what he's doing in DeKalb, right, at Shepherd's? Is that correct? Serenity House.
So one of the things that we're trying to do to reach out to the transitional houses is get them more food. So I'm going out and actually going to the different houses. And the common theme that I've been hearing is that they order food from us once a month or so, and their capacity is minimal. So we went out and actually are visiting each of the different homes, trying to determine how we can better serve them and get more food to them. And for instance, in Serenity House in Auburn, they have 3 houses up there. So what we've done then, we went up and visited, and we've worked out a deal now that they come to us every week instead of once a month. And what we found was they were going out to grocery stores and buying milk and bread and certain things that we're going to give them for free. So we have a large supply. We cover 9 counties. We work with 400 churches, pantries, soup kitchens. We have 10 trucks that go around picking up food and dropping it off. And again, just getting the word out that we'll be able to help them. So they're going to come back, take that money that they were spending on milk and bread and cheese, and we're going to give them that so that they can order more protein from us. And it's working out great. So now they're coming down to our place 4 times a month instead of once a month. They're getting a lot more food. They're getting a lot more protein, vegetables, produce, and that's what we're trying to do. We're trying to get that. So in addition to that, we've started 2 years ago, we started growing our own food. So we have 3 farms that are growing food for us. So this year we're going to have 9 acres of corn, 18 acres of green beans, 4 acres of cantaloupe, 4 acres of watermelon, and we just added this year 2 acres of cabbage. So we're going to be giving out fresh produce throughout the community. In the same token, we're trying to work with these transitional houses. Then if we give them more food, maybe they can help us glean the fields. The farmers are allowing us to glean the fields at the end of the season, and instead of plowing this stuff under, but we need help. We need help with the hands, because normally when they call me, they say, John, it's going to frost tomorrow. I got an acre of peppers. And I know that was an example last season, and I called Allen County Waste Department, and they sent 6 folks over, and we were able to glean 5 pallets of bell peppers. But in reality, we probably could have received 30 pallets if we would have had the hands to do it. So if you know any of the transition houses that are needing more food, anybody needs food, let me know. We're here to help feed individuals. We don't want anyone to go hungry. And we have programs for seniors. I mean, right now we have 1,135 seniors getting food every 2 weeks. We have a backpack program, after school feeding. Saturdays, we have a helping hands from 9 to 11. Anybody can come and get food. And on an average Saturday from 9 to 11, we have 750 families. But we got more. We'll give out more. So if you need help, anybody you know needs some food, I'll stick around. Thanks.
Any other questions? We have like all of a minute. Oh, here we go.
I have 2 quick questions. One for, can you hear me?
You're on.
Okay. One's for Mother's Hope. So if a mother come and they don't have someone to give them a reference because maybe they burnt their bridges or scared of the reference somebody might give them, can they still be qualified? Mm-hmm. Okay. And then the other one is for Healthier Moms and Babies. Are your staff able to house surf with clients to give them services?
Yeah, they go wherever. So if they move from one apartment to another apartment, as long as we know, we'll meet them.
Of course. This is what happens every time.
Just before I don't know if there are going to be any more questions, but before we wrap up, on the topic of food, take all of the pizza. I cannot take it with me. Please, take it all.
Thanks, Erin. Any other questions?
So our next meeting is May 23rd. We're going to cover the topic of nurture. We've got a great speaker coming in from Indianapolis from IU University. So also in your piles, you have an evaluation. Please, please, please take a moment to fill that out because we asked specifically about speakers and what information you want from us and from our network. So let's give a big round of applause to our panel and our speakers. And thank you all for coming. And nobody leaves without pizza. Is that right, Erin? Thank you.
Thank you. We probably could get smarter and get gifts for people who do this, but thank you.
I
know.
It's so nice to meet you.
You give us all plenty.
Oh, yeah. There we go. Perfect.